Hello, everyone, and welcome to Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation. Now, last week, we had Sarah on to talk about the things that happen around the age of 35, going to 45 to 50, in other words, menopause, and how that affects the brain and the rest of the body. Now, I got to say, it's shocking to me how very few people really realize how important the hormones are to the brain and body. And simply by explaining these things, it's like you just see the lights go off. Does it go on? The lights go on in their in their brains when they understand that things like estrogen can help protect the brain, can help boost brain power, can help with memory, can help in so many different things, but not just in the brain. It also helps in the cardiovascular system. It helps with blood flow. It helps with flexibility of the blood vessels. It helps to deliver blood and oxygen to the tissues. And the other thing is progesterone, which is even less known about. Progesterone also protects the brain. Progesterone is helpful for sleep. So people who are not sleeping well may be low in progesterone. Anyway, she's going to talk to us more about that. And of course, testosterone and the thyroid hormones. Having people who can handle this, specialists who can handle this correctly, but especially for women who are going through that period of menopause, can be life-changing, in fact, life-saving in many cases. The unfortunate truth is that even in America, less than 1 in 5 OBGYNs, the people who are trained to take care of women, actually know how to help women navigate this period. So that is tragic. So you can imagine, if it's this bad in the US, you can imagine how bad it will be in Nigeria. So it's imperative that, one, you know how to take care of your hormones, and number two, by the way, we talked about that last week. Number two, you find the right kind of person who can help direct you on how to take care of your hormones, because sometimes you can't do it by yourself. You need professional assistance. And with that, we welcome back to the show, Sarah Gibson. Welcome back, Sarah.
Thank you so much for having me. I love being here.
Great. Well, we love having you. So we have a short time to really get into this. And we want to talk about how is it the Vitality Mix?
Vitality Health Matrix. Yep. So we just use the matrix method. Yep.
Okay, tell us about that.
All right. Well, I mean, really, there's a lot of things that can go into it. What we do is we start with testing. We love science and data. So we figure out what's going on with your hormones, your vitamin D, your thyroid, your insulin levels, all of these things. Then we treat it using prescription medications, supplements, and then we layer it in with nutrition counseling and fitness instruction, and then give you the support. You know, if you're need to troubleshoot some side effects, you have questions, we kind of have a whole team there walking you through the whole process. Because the truth of the matter is that 80% of women are going to struggle going through perimenopause and menopause, and only 12% are going to find help when they ask for it, which means the majority of women are struggling with symptoms, struggling with sex hormone imbalance, and don't have anyone to turn to that are going to help them walk through the process. So that's why the company was created, and it's been life-changing for so many women. I'm super happy. So, but there's always more to help.
Absolutely. There's a lot more, I promise you. All right, I made this mistake. I apologize. We didn't get your website and contact information last time. Can you give it now?
Yeah, our website is vitalityhealthmatrix.com. You can reach out, book a call with our team, send us messages, follow us on Instagram, TikTok, Facebook. We're all over the place.
So I'm a 55-year-old woman. I'm having hot flashes. I have knee pains. I can't hardly get out of bed. I don't sleep well. My husband wants sex. I'm not giving it to him. I come to you. How do you help me?
Yeah. Yeah. So let's talk about hormone replacement therapy and what that looks like. There's two different phases where women are going to need hormone replacement therapy. Number one is when you start hitting perimenopause. So anywhere from 35 the whole way till you're through menopause. The most common sex hormone imbalance is that you'll get a little bit of a drop in estrogen, but your progesterone levels will plummet, which means you start having difficulty sleeping at night. You'll wake up at 3 a.m. with your mind racing, and you can start having symptoms of something that we call estrogen dominance, which means you have enough estrogen, but you don't have progesterone to balance it out. Estrogen is the exciting hormone, progesterone is the calming hormone. And so when you have too much of the exciting hormone, you can get very irritable. You get overproduction of the lining of the uterus. So very heavy menstrual bleeding, uterine fibroids, fibrocystic breast tissue. And this is the phase where many women have to have a hysterectomy to manage these symptoms and these side effects. Where in our practice, all we do is supplement with some progesterone. We normally use topical progesterone cream. We balance everything out again, and then you don't even have to have surgical intervention. So that's the first thing that's super important to know. And then the second phase of that would be then if you just have low sex hormones in general, you have no estrogen, no progesterone, no testosterone. That's typically when we'll replace all of the sex hormones, okay? And it's something that you don't need as much as you did when you were in your 20s, but you need a little bit to get that brain protection, that heart protection, that bone protection, right? So that you don't end up with osteoporotic fractures or dementia, right? Or heart attacks or strokes. It even protects against certain types of cancers. And so when we're talking about that, we're talking about anything that can be sent to your local pharmacy. But there's two distinct kinds. There's synthetic hormones, and that's normally what you think of when you think about the birth control pill. That's created in a lab, and if you look at it under a microscope, it's completely different from what the body naturally produces, okay? So it does set you up for some risk factors like clotting disorders or clotting, like blood clots. But there's also bioidentical hormones, which are plant-based. Most of them are derived from wild yam, and they're just altered a little bit so that they look almost identical to the natural sex hormones that your body produces. And so much so that it will raise your plasma levels and bind to the same receptors. And so you can get them in a local pharmacy in the form of a patch. If you're on an estrogen patch, you do have to take oral progesterone to prevent never that tissue overgrowth, right? But those are plant-based, and your body responds very well to just even a low level of those. But it can also come in a cream, in an oil. So there's a bunch of different types of it. But those are the two ways that we supplement the sex hormones that your body needs.
Okay. Now, you didn't mention anything about vitamin D and testosterone. Where do they come in?
So vitamin D, we treat in everyone. So what we do is we test their levels. If they're below 65, we'll start treating, and we treat two ways. Number one, we do high dose vitamin D supplementation. So anywhere from 5 to 10,000 IUs of vitamin D3 with vitamin K, normally 200 milligrams. And we do that every single day. Because if you don't have vitamin K with vitamin D, you can set yourself up for hardening of the arteries. So you always want to have that combination together if you're going to supplement. And then the second thing that we do is we prescribe D2 in a large dose to the local pharmacy. So 50,000 units taken once weekly for 12 weeks. Normally, the combination of those two things, again, it just depends on what the vitamin D level is. And most women are coming in with vitamin D levels in the 20s or maybe low 30s. That combination will raise their vitamin D level anywhere from 30 to 60 points. So again, it just depends on where they are. But our goal is to get vitamin D to 80, and we always retest and make sure. And then our maintenance is just supplementing with either 2,000 or 5,000 IUs of D3 plus K2 daily.
Why D2 though? I mean, we've been made to believe that D3 is more superior, is more bioavailable and all that. But why bother about D2?
The reason that we do it in the US is because D2, we can send to a prescription to the local pharmacy and insurance will cover it. And it's such a huge dose, 50,000 units. So you can just kind of take it once a week for 12 weeks, and it does help with supplementation. If you only supplement D3 with the K2, you can still get great results. But then if you're not going to do a prescription, I would do like 10,000 units a day and make sure retesting.
Yeah, for my patients, especially Black patients who are much more susceptible to vitamin D deficiency, nothing less than 10,000.
Oh, okay, perfect. Yeah. You don't do prescription D2 then? You don't have to. You find that the 10,000 of D3 with K raises their levels. That's perfect. Yeah, that's perfect. Love it.
Yeah. Yeah. So that's interesting. Now, so there are some nuanced approaches, especially depending on special cases. For instance, those who have had, maybe they're recovering from breast cancer, they've done the chemotherapy, the lumpectomy, or the mastectomy, they've removed their breast and all that, but they're very concerned. They're going through all these symptoms, but they're very concerned about having their breast cancer come back if they go on hormone replacement therapy. What do you have where that is concerned?
Synthetic hormones are absolutely no. I wouldn't put them on synthetic hormones that are created in a lab. But oftentimes we have an educated discussion with our patients and we say, okay, look, we're not going to put you on a synthetic hormone, right? We obviously don't want to increase your cancer risk. However, bioidentical topical hormones may be an option for you. And there's two ways we approach it. Number one, topical either combined estrogen or progesterone cream that's made from wild yam, right? That's always an option, so that they can mitigate some of the systemic symptoms like hot flashes or night sweats.
Mhm.
But the other thing is that there are vaginal forms of estrogen that are safe for everybody because they stay locally. So those are great for women who have recurring urinary tract infections, vaginal dryness, difficulty climaxing, some of those types of things that will help a little bit with libido if everything is working correctly down there, right?
Okay.
So that's an option, and it really depends on what symptoms you're trying to work with and trying to mitigate. But
How about for brain fog? Person complaining about I'm losing
Mhm.
my memory. Da, 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 da.
Yep. So for those cases, we want to work higher up in some of the precursor food chains, right? So the things that would become sex hormones. So supplementing with DHEA, I think we spoke about off camera.
Mhm.
DHEA is a substance that can convert into your own estrogen and progesterone, right? And again, you don't need the same high levels, right? Your body can just produce a little bit of its own sex hormone. But then there's also other ways. You can support the adrenal gland so that you're not spiking cortisol. You want to decrease inflammation and focus on gut health, right? And then you want to nourish the brain with brain vitamins. B vitamins are so important, right? So some
Right.
of those things. I actually have a very large amount of women that are breast cancer survivors and have been told they can't take hormone replacement therapy, but I will use bioidentical hormones, either a low dose estrogen patch with oral progesterone, and then they're just closely monitored. And the reason they do that is because they know that their breast cancer risk of coming back with hormone replacement therapy, I believe, is around 7 or 8%, but their risk for developing cardiovascular disease and dementia is higher than that. And so it's
Mm.
just the risk outweighing the benefit
Well,
and
I'm
being
glad you pointed that
hypervigilant.
out.
Mhm.
I'm sorry, say that and the what?
And it's just them being hyper vigilant, right? Knowing that this is possible, but they're just very good with their breast cancer screenings, but also knowing that they're taking, they're protecting things beyond just avoiding getting cancer.
All right, we're going to take a quick break now, but I will be curious as to what should they be watching out for? What should their physician be watching out for while they're, or what would you be looking out for to make sure that the cancer doesn't come back while you're
Mhm.
treating them? But we have to take a break now.
As a charity. I'm 23 years. I'm a sickle cell patient.
It's Destiny Dalademusa. I'm 22 years old, diagnosed with sickle cell anemia disease.
When I came here, I was having crises back to back. But since I started taking that drugs, no more crises. I'm feeling improved.
And the first drugs given to me here, it actually worked because I know I can sleep well, less fatigue, and don't have frequent crises anymore. And even when it comes, I don't feel it that much. Just mild, and I feel strong. And I can do things now, more things that I couldn't do before. I know I could actually walk around some distance and feel tired, but not anymore. I actually do those things. I feel better with the drugs, yeah, because I know it's improving my immune systems and keeping me healthy and strong, stronger than before. I want to say thanks to the people and the organization. I want to say thank you because you're doing a lot to also need the help and actually to also need assistance with our health.
Welcome back, folks. So we are talking about different scenarios in which hormone replacement therapy can work, and we're talking specifically now about breast cancer. What are some of the things that you'll be watching out for to make sure that while you're providing the hormonal therapy the patients need, you don't raise the risk for breast
Mhm.
cancer return?
Yeah, and so that we work in tandem with their oncologist. We don't take over for the oncology team, but it
Mhm.
depends on what types of cancer they had, right? If they had estrogen and progesterone positive receptors, we have to just be a little bit more cautious with elevating any estrogen progesterone within the body. But every breast cancer survivor knows that they have to do at home self breast checks, right? Looking for any lumps, looking for the screening, going and getting their blood work done. And that's really what we're talking about, because you're going to be vigilant if you've had any forms of cancer. You're going to be vigilant with monitoring forever, right? And so if you are knowing your own body and knowing what to look out for, looking for new masses, going and having, ultrasounds done or mammography or talking with your providers, right? Then you can safely use things that are going to increase the natural production of estrogen and progesterone so that you can get rid of some of those systemic symptoms.
I'm probably going to focus a lot on inflammation, making sure the inflammation
Oh,
is
absolutely.
controlled. Yeah, because
Yeah,
that
absolutely.
Can you talk about how things like inflammation and hormonal balance and toxicity are risk factors for development of breast cancer? Because
Well,
I'm saying this because Black people, as you know, Black women have the highest risk and rates of breast cancer. Black men have the highest rates of prostate cancer, by the way. And so, but people don't know why. So, are there certain things that we can point out?
so I think it just goes back to genetic makeup, right? Like the DNA. We all have certain things written in our DNA, but it doesn't mean that it's always going to be expressed. So that's why, for example, family history is so important. In my family, high incidence, everybody has high blood pressure and diabetes and high cholesterol, right? And so for me, I'm like, okay, I know that I'm set up for that. I know that my family history is that. So I'm always going to screen it, but I'm going to do the things that are going to decrease that expression in my body, keep my weight down, focus on eating whole foods, fiber, things like that. So when it comes to breast cancer, oftentimes we don't know why things are expressed, but anything in the body that could go wrong is going to go wrong when inflammation levels are high, right? So anything that we can do to manage inflammation, like making sure your vitamin D levels are into the 80s, right? That your gut health is very well rounded, and that you're monitoring anything that is abnormal in your body. But for our patients, specifically managing inflammation, there's something that we use. We use low dose naltrexone. Naltrexone at higher levels are what we give for patients that have addiction issues.
Yeah.
But research shows that at very low doses, maybe 2 to 4.5 milligrams daily, it is fantastic for suppression of inflammation.
Interesting.
So, for example, our ladies that have Hashimoto's thyroid disorder, which is an autoimmune disorder where your own body attacks the thyroid gland, they can have the TPO levels up into like the 900s. And within 90 days of being on low dose naltrexone, their thyroid antibodies are back down to like less than 100. You want them to be 0, but it is such a huge improvement. And so women will go back then and have their thyroid levels checked and say, I don't have thyroid antibodies anymore. I feel so much better. My thyroid gland has improved. So there's certain medications, some of the GLP-1 medications. I know there's more research out there about those injectables, semaglutide, tirzepatide, that decrease inflammation within the body, have been shown to have some benefits for patients with dementia. Now they're using it for reversing fatty liver disease and even for getting people off of dialysis. So I think really just knowing, how to manage inflammation, knowing what the risk factors are, and using the lifestyle, anything that you can lifestyle wise to monitor yourself and to mitigate those risk factors.
What do you do for people with, okay, so two more things before we wrap up. What do you do for sleep? And two, for especially women who are going through menopause?
Yeah, I mean, at the end of the day, hormone replacement therapy is so important for women at some level, even if you can't take synthetic hormone replacement therapy, because it decreases dementia risk, helps prevent osteoporosis and fractures, helps cardiovascular health, so protecting against heart attacks and strokes, and it actually diminishes your risk for certain types of cancers and overall mortality. So at the end of the day, hormone replacement therapy does have to be an educated discussion between you and your provider or somebody who can help you get your hands on it. because it doesn't just only help replace sex hormones, it helps with aging well, right? And helps with your quality of life, even past menopause. And I suggest it even past the age of 65, like take hormone replacement therapy forever.
But so that was a concern, by the way. They were like, "Oh, after 65, you may it may the risks might outweigh the benefits." What do you have to say about that?
There was a study that was published in, I believe it was March of 2024, 10 million women that they studied from 2007 to 2020 over a 12-year period who continued hormone replacement therapy after the age of 65. And even just tiny low dose hormone replacement therapy, so estrogen and progesterone, topical was the best outcome and that did all of those things. So those were the ladies that didn't get dementia, had decreased cancer risk, had lower heart attack, lower stroke, and lower osteoporosis fractures.
So you can start at any point in time. What if
At
they've
any point.
never had hormonal replacement therapy before, and suddenly in their 60, when they're 67, they want to start? Is there a risk?
I normally recommend that you start it within 10 years of going through menopause. So that's still the recommendation, or before the age of 60 or before the age of 60. So we start women on hormone replacement therapy even before they've fully gone through menopause. And then just low dose and topical amounts. So I like bioidentical versions that's plant-based from wild yam. Some of them you can even get over the counter. So just that little tiny amount can still give your body some of those protections.
And you cannot eat your way into hormonal replacement. There are no foods you can get this from in
I mean, a little bit soy. I mean, soy products. So kind of, just in general, eating a whole foods diet, getting enough protein within your body, managing stress and inflammation, getting sleep. Some of those lifestyle things can help support your body's own production of sex hormones, specifically from the adrenal gland. So those are some lifestyle things, but they just take longer and they take a little bit more discipline, but it doesn't hurt.
I know some cultures like in Japan, they say that they don't even know they don't even have a word for um, hot flashes or some of these other sort of symptoms because they don't have them because I guess maybe they have access to wild yam or some of their sweet potato brands can actually help them produce enough to counteract and produce enough sex hormones to counteract the effects of menopause. So
Yeah, avoiding high processed foods and avoiding stress. I mean, those are the big things. Those are the women that kind of coast through menopause and don't have the symptoms are the ones that pretty much eat a whole food diet, the closest version of from where it comes from the ground, right? So
true, unaltered in any way.
correct.
I mean, bread is processed. People don't realize this, but bread is processed
Right.
food too.
Yeah.
People don't realize that.
Better for you to eat a potato.
So sleep. You're going to say something about sleep?
Yeah, I mean, sleep is one of the first symptoms that women will struggle with, and that's often because of estrogen dominance. So they're just losing that progesterone so quickly. So they wake up at 3 a.m., they can't fall back asleep. So again, we use progesterone cream. We'll do stress management techniques, and then just supporting with lifestyle, right? Like getting out, like mental health, getting out and sun on the face, getting some steps in, deep breathing exercises, some of those things. So melatonin is a hormone that is also produced in the body that drops as you go through menopause and perimenopause. So some of our women do supplement with melatonin at night, but melatonin just helps you fall asleep. Magnesium will actually help you to stay asleep. So magnesium glycinate is great if your mind is racing. Magnesium really of any form is good if you take it at night. Magnesium citrate will also help for you being able to stay asleep and to have good gut health. So you'll have effective bowel movements the next morning. So it just depends on what your outcomes are, what your current symptoms are, and you just kind of reverse engineer and fill in the gaps. So
bottom line is that there are solutions. You do not have to live in pain and suffering, right?
absolutely.
Awesome. Well, thank you so much again. We're going to grab you back before March, I hope.
Yeah, I hope so as well.
But I wish you all the best in what you're doing, and I'm sure you're just going to continue to help more and more people, and hopefully you start doing more work internationally rather than just locally as well.
Yes, absolutely. Thank you so much for having me. It's been a great time.
Well, thank you for being on. Any final words? I think we have a few seconds.
No, I think the biggest thing is exactly what you said, don't suffer. There are things that you can do, even just simple free things that you can do to mitigate symptoms, and just knowing where to find help. That's the best thing. So we have a free online community. I'll give you that resource as well. It talks about the hormones. We have a hormone masterclass. It has a little eating plan. It has a handout about perimenopause and menopause symptoms and how it relates to the 5 hormone imbalances, and then something even for gut health. So you can at least get some resources just to educate yourself. So
awesome. We definitely will display that and make that available to our viewers.
Okay.
Awesome. Thank you. And thank you folks for joining us, and see you next week. God bless. Bye.